Here's our full thickness rotator cuff tear of the supraspinatus. You can see the tear is very mobile. We're inserting our first anchor in the front. First we place an awl and then we tap the hole for the proposed anchor in the greater tuberosity. You can see the bone bed is to the right and the soft tissue is to the left. Here we're placing our bioabsorbable anchor within the greater tuberosity or bony bed. This anchor holds the sutures that we're going to subsequently place through the rotator cuff tissue. We place a second anchor behind our first anchor to increase our surface area as far as the coverage of the greater tuberosity, as well as increase the number of knots we have in the rotator cuff to hopefully facilitate healing. Here we're putting in our second bioabsorbable anchor, once again behind the first anchor. Once again, the sutures then come out of the anchors. You can see the sutures there. We were first placing a suture through the rotator cuff tissue. Now the sutures are all through the rotator cuff tissue. See the bony bed to the right, the rotator cuff tear, and then the rotator cuff tissue in between. Next we are tying knots. So we're trying to oppose the rotator cuff tissue down to that bony bed that we had prepared previously using a knot pusher here. And we're tying these knots subsequently. Now the rotator cuff tissue is opposed down to the greater tuberosity bone bed. A second row of anchors were used in this case to facilitate restoration of the anatomic rotator cuff footprint. This is another bioabsorbable type anchor. You can see the sutures to the left, which are going to hold the rotator cuff tissue down. The knots, the suture is then cut. A second anchor is then placed in front of the previous anchor. You can see we're trying to find our pilot hole that we had already drilled. Once again, the sutures are to the left, the rotator cuff tear is to the left, and here's the plastic anchor that's going to hold our suture in place. The sutures will then subsequently be cut. Now you can see our completed rotator cuff repair with our medial row of anchors as well as lateral row of anchors with the rotator cuff tissue opposed to the bone.